Hello, 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 everyone, and welcome to the Dr. Tamara Beckford Show. I am excited, as usual, to have on here a doc who's been practicing for many, many years, and she has an exciting news to tell all of you there. All of you out there in the land, she's a wonderful pediatrician, and she's putting all of this information in a place for you. But as things, you know what? I definitely have to make sure that I bring her in the fashion that you all are used to. She's not just going to come up here and just be like, oh, we just have Dr. Blah, blah, blah. No, we have our doctors come on in style like they are rock stars because they are. Alrighty. So now, if you have been interested in wondering, how do I look for and what is the importance of a medical home? Today is the show for you, right? So this wonderful doctor friend of mine, she's a graduate of St. Louis University School of Medicine. She did her residency in pediatrics at the Michael Reese Hospital in Chicago. She's been practicing for 42 years, and she is the owner of Pediatric Healthcare Unlimited. Now, as I mentioned, she's been practicing for 42 years and she has brought and distilled all of that information in a wonderful book that she has coming out soon. So keep your eyes and ears to the road for this wonderful book called The Primer on Kids Medical Care. Who am I talking about? The one and only Dr. Kathie Wuellner. Hello, 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 Dr. Kathie. How are you?
I'm good. Thank you. Thank you for having me on.
Thank you so much for agreeing to stop by. Now, I know that you have a busy practice, so we really, really do thank and honor that the fact you've taken a few minutes out of the practice to talk to us here on the Dr. Tamara Beckford Show. Alrighty, we're going to get right into it, right? So you have been practicing for 42 years in pediatrics, but before you decided to do that, like, what was going on when a little Kathie decided, you know what? I want to become a doctor. Tell us that story. What made you decide to go into medicine in the first place?
It was a long time ago, so I have a little difficulty with memory that far back sometimes. But
Feelings. Let's do feelings. Emotions, we don't forget.
no, no, that's for sure. So,
Mhm,
science always interested me, and I don't know. I think growing up watching Dr. Kildare on TV and a few
mhm,
of those other programs kind of spurred the interest, but I
mhm,
also just felt compelled to want to help people.
mm,
And so I had some family members who were nurses,
mhm,
but I thought I could shoot for something a bit higher and
mhm.
decided on becoming a physician.
Oh, love it. Alrighty. So now through the journey of becoming a physician, because you had those who were in the family, they were in healthcare, they were doing nursing, you definitely had this drive to help. And you're like, okay, that and you're seeing these shows. But when you got into medical school, you chose pediatrics out of all the specialties out there. You have family med, internal med, OBGYN, surgery, but you chose peds. What made you choose pediatrics?
I think the thing that drove me to pediatrics was just the fact that you're getting pretty constant gratification back from kids. They'll smile, they hug you,
Oh.
they um, it's I found kids very fulfilling in the
Hmm.
sense that um, they just seem to appreciate everything that you do for them.
Hmm.
And um, I liked OBGYN, but the hours of spending nights in the hospital delivering babies, I didn't feel
Hmm.
was going to suit our family life. So pediatrics was my other big love. So I went with that and I haven't regretted it.
Oh, so the love that you're getting, you said kids give a lot of unconditional love, even when they're saying mean things to you, mean things out of love. If they're
And
mad
even
at you,
when
they're
they're
mad
very
at you
small.
today.
Yeah.
Exactly.
Yeah.
So definitely. Now the thing is, with you being a pediatrician and having practice for 42 years, is that you have now had the like opportunity and the privilege of being able to take care of families who have families, and they're all coming to Dr. Wollner. Tell us, when you're seeing these families, what's going on in, like, how are you feeling? Tell us, what are some of the things that you're noticing that they're coming to you and saying?
Well, so it's really gratifying to be sometimes now on the third generation
Mm-hmm.
um, of families, and it's really crazy
Mm-hmm.
how in the younger, newer members of the family, I can look back and remember their parents looking like that when they were that
Oh,
age.
yeah.
Um, but another thing that I find really fulfilling is that taking care of patients in general is not only taking care of their medical needs, but their psychological needs have a very big role to play as well in one's
Mm-hmm.
overall care. And having the knowledge of long-term care of families,
Mm-hmm.
it's very easy to put into perspective
Mm-hmm.
at times, families' difficulties, how they deal with things. If there's a chronic medical condition that is within that family, um, how to talk to them about their medical
Mm-hmm.
history.
Mm-hmm.
So it really provides a big, all encompassing kind of picture that's a lot easier to be able to provide care.
Wow. I never thought about that from the pediatric standpoint of being able to follow in the journey. Rest assured, you're following the journey of the child, and you see them until what age? What age does your
22.
till 22? Oh, so you don't get Dr. Boutros. I love you, my pediatrician. She has since retired, but man, I tell you, my heart sank when she told me I couldn't come back.
Yeah, I'm told that many times. Yes.
Yes, absolutely. So at 22, you're able to see them from infancy, like, from birth until 22. And then for those who are starting families and then they're coming back, you're right, you're able to really track certain medical conditions, the psychological, the psychosocial conditions that are within the environment, and be able to help to break some of those barriers because you know them for so long, you know the
Right.
family for so long. So that's such a big impact of being able to break barriers with just these, the fact that you are seeing a family, and you can now help that family to advance and to project and to do healthier things, and to not have to relive what they felt like it just runs in the family. Wow, that's such a
Right.
big role. How does that feel, being able to play an impact in that role? And are the patients recognizing and realizing this?
I think to a certain extent they are, and
Mm-hmm.
um, a lot of times you don't already have to ask a whole lot of questions, and you can just go right into a discussion of I don't think we're going to have to worry about um, cancer in this generation.
Mm-hmm.
I
Mm-hmm.
know that you had it, but I think there's a good chance we're not going to have to worry about that the second time around.
Oh.
Or, you know, now we know your dad has diabetes, and
Mm-hmm.
we need to make sure that we practice good things to minimize your chances of developing diabetes through obesity or whatever predisposing factor there might be. So,
Love it. Love it. Definitely is a powerful, powerful position to be in, to be able to effect such change with within the family, because you're seeing the projection of different generations and you're able to break some of those generational issues. Alrighty. So what and when out of pediatric residency, did you just start your practice immediately, or did you um, work for a practice and then start your practice? Like, how did that come along?
I worked for a year after finishing residency, um, giving me enough time to then establish my own office a year later. And
Mm-hmm.
then since that time, I've pretty much had my own office with a
Nice.
little
So,
permutation here and there.
okay. All right. So now you've had their own office and you've been doing this for quite a while. Now you mentioned that there's something that's important about a medical home. And people at times they're not really recognizing that importance, but there's something that you really want to highlight. So tell us, what are some of the important aspects of having a medical home that we who there are people that just bounce from, doctors to doctors, and they're really not thinking about it. But I know as an ER doc, I ask all the time and try to educate our patients on it. But go ahead and tell us, why is it so important?
Okay. So, in a medical home is important not just for pediatrics, but as well as for adults as well.
Absolutely.
And um, so, one is the whole concept is basically to have a medical provider that
Mhm.
you become established with and that you can call anytime you have a problem. It's
Mhm.
also the same medical provider that you would go and see on a regular basis for your wellness exams, which
Mhm.
are really important. Um, and it provides you just an opportunity to be able to call and get help on a much more quicker basis than a lot of people are able to these days. Um, a second goal or concept of the medical home is that it provides um, a team of people within that office
Mhm.
that can help you, be it just talking to a nurse for some advice, um,
Mhm.
calling and asking for information about your medications, whatever. But it's a whole team within an office that comes together to take care of every patient, from the front office person to the nursing staff to the medical provider to medical records. All of those areas are pretty important, and that's all in one location. And
Mhm.
then when when you see the same medical provider and or someone in that particular office, your care is fairly coordinated, meaning your records are always there. They're very easily accessible. They can be
Mhm.
reviewed in case you're not seeing your specific provider, but that all of that information is still there. So people aren't grasping for straws as to what medicines you're taking, because particularly adults will tell you that they're on a blue pill and a green pill and a
Yes,
pink pill.
ma'am. Yes,
And,
ma'am.
um, you know, there's a lot of those out there. So having all of that information in a central location makes it much easier to manage a patient.
Mhm.
Um,
Mhm.
Making sure that there's not duplications of
Yes.
medications, making sure that there's not medications that can don't coexist very well together.
Yeah,
That
absolutely.
um,
Negative interactions.
right.
Yeah.
And um, Unfortunately, going to urgent cares,
Mm-hmm.
they don't have that information, and sometimes and medication may be given with good intent, but yet not knowing exactly what the patient might be on could make major negative impacts on the patient care.
Absolutely.
Um,
Absolutely.
so another important concept of having your own medical home.
Mm-hmm.
And then over time, and I see it quite a bit, over time, the longer that you stay with your provider, I think you form a much better working relationship, and
Mm-hmm.
each each partner of that relationship becomes more familiar with each other. The patient becomes a little more comfortable with talking to you.
Mm-hmm.
And I know in my practice, having taken care of kids for long periods of time, and now these days with a lot of mental health issues in kids, I find that my teenagers can fairly easily talk to me and communicate with me and open up a little bit. And I think a lot of that comes just because they've been coming to the office for so long, they feel
Right.
more comfortable doing so. Um, because I don't think that they would feel very comfortable spilling all of their feelings to you going to the emergency room with
No,
meeting you for the
not at
first
all.
time or something.
Absolutely.
So
Absolutely.
I think long-term relationships are very important to form between the physician, or physician extender, and the patient. And
Mm-hmm.
then the other thing that having a medical home, it overall helps reduce medical costs to a certain extent too, because there's not a
Absolutely.
lot of duplication of services,
Duplication. Mm-hmm.
duplication of medicines,
The
yeah,
labs.
lots of testing. Yeah.
Mm-hmm. Mm-hmm.
And then the other big thing is that your medical home provider can help coordinate all of your care. If you have specialists, um, they can help get you in sooner if you're having an issue. Um, they can talk to the specialist. You can we can give them our perspective of the
Mm-hmm.
patient to the specialist, because the specialist just sees them in a tiny little niche of time. They don't see
Absolutely.
them many times over and over. So that kind of information for the specialist is quite important as well.
Absolutely. Absolutely. I love some of the tenets that you have laid out about the importance of a medical home. And there are a couple of things that have really stood out. And, being on the side of the medicine, which is the emergency medicine, where I see patients in a limited time, and also most of the patients, I mean, there's some that we have that we call frequent flyers that we see pretty often, but most of the patients, I'm just seeing you for the first time. So even at times, if you've come to the hospital, like I might just be seeing you for the first time. So that my goal, yes, is to form a bond, a really quick bond, but that's just what it is. It's a short bond for a short period of time.
Right.
And I've still seen a lot of people, and I love that you've mentioned this. And this is so important that I think that we need to highlight for our patients who have specialists. When you have a specialist, it does not mean you no longer go to the primary physicians, which is your medical home. Because your medical home, it's still important to coordinate what's going on. Your specialist is there to deal with the specialty related issue. And
Correct.
sometimes, depending on what specialty it is, it's not fair. And that's what I tell my patients. It's not fair to this specialist who's here to deal with just this particular related thing to now not know everything else that's going on, but you're not no longer going to your, medical home and making them aware about the specialist's recommendations or what's going on, or to have the specialist take on everything that the medical home takes care of, because the specialist really is trying to zone in and handle this particular region or area of disease process that they're trying to amplify so that you can stabilize and have you overall be well. But your medical home
Right.
still needs to be the primary area for most cases.
Yeah. And making sure too, the medical home is, well, the medical home is there to make sure that you're making it to all of your specialty appointments as well,
Yeah.
and that everything is getting covered in an appropriate and timely basis.
Absolutely, absolutely. Now, the other thing that I thought was important was when you mentioned about kids, once they get to that teenage phase, there are a lot of times that mom and dad don't know anything. You guys don't understand. Mommy doesn't understand, and daddy doesn't understand, right? But if they've been going to that medical home for a while, then they feel more comfortable, especially during those types of exams when the parent can step out and then you can have that one-to-one conversation with a child, then you can truly find out what's going on deep inside. And especially when it
Right.
comes to probably bullying and mental health issues and feelings of insecurity and self worth, which we know is huge right now because there's so much of that's going on. So that's such a
Very.
great
Yeah.
point about being able to have that medical home where they feel comfortable talking to their doctor, their private doctor, right? Because
Exactly. Yes.
I love it. I love it. Alrighty. So with you talking about this medical home, in addition to all of that, you decided to write a book. So what made you, like, what compelled you? What came out inside you? You know what? I want to
So,
put this in a book. Go ahead and tell us.
okay. Um, I never feel that there's enough time during an office visit
Mm-hmm.
to really give out all of the information that is really important for a parent or a patient to know
Mm-hmm.
about whatever thing that we're dealing with at the time. And but then the other thing also is that in pediatrics, kids get sick at all hours of the day and night.
Absolutely.
And parents, I know, because I was one really early on too, straight out of residency, you feel very insecure, like, oh my gosh, what do I need to do, or what do I need to worry about, or do I need to go
Mm-hmm.
to the emergency room? What do I do? And so over the last couple of years, I've formed this idea that I really wanted to put knowledge together in a book that could help answer those kinds of questions about what you do in the middle of the night,
Mm-hmm.
and what these symptoms might be. And I know there's a lot of things on the internet where you can go and look all that kind of stuff up as well. But I just wanted to put it all in a concise little book. And so that's what I've done.
Mm-hmm.
In addition, kids have rashes to boot. And
Yes.
and so there's one chapter that involves just rashes. And
That alone is makes the whole book worth it. I'm just telling you. That alone.
and there's actual photographs of rashes to go with each rash. So
With the description.
you can really get a good picture of the rash. So, um, so, so the intent was to provide education, kind of instant help to parents. In addition, at the end of the book, there's, we talk about, when kids are vomiting, you need to give them clear fluids, but in the
Mm-hmm.
middle of the night, you don't think you have clear fluids. So I've put recipes in the back of the book on how you can make
Wow.
some electrolyte containing solutions from things that you will have at home already. Um, And then there's tables of all different kinds of medicines that we routinely use in pediatrics, weight-related dosing, and then just some other information that you can't really easily put your finger on. So I'm pretty excited. Hopefully it's going to be out in about 2 months. It's in its final process of going to the publisher now. So pretty
Wow.
excited
So
about
we're
it.
thinking like around for the fall of 2024,
Yes.
which is
Yes.
great, right before respiratory season happens,
Right.
which
Yeah.
is
And in addition to the pictures of rashes,
mhm,
I also have pictures of other things like what the breathing, what the
right.
lungs look like in asthma, what acid reflux anatomically looks like. So there's a bunch of other helpful pictures as well.
This is a well thought out book. And it sounds like it's going to be used. Rest assured, it sounds like this is a lot of distilled wisdom that you have for your patients and their families. But based on being an ER doc, I can see that book being in the ER also, because rashes are one of the bane of most physicians' existence, in that it is we see it often, but not often enough to, especially those who have not been fully trained in pediatrics.
Right, right.
You see it often, but not often enough at a consistent basis to be able to fully feel comfortable. So to have a book that's written by a physician that has these rashes and saying, yes, this is what this is, that's what that is, I'm pretty sure that your book will be used in the ER by ER physicians.
I'm hoping so. Yes.
Absolutely. As an ER physician, I'm like, oh, okay, let me get this book so that I can have it. Wow.
I will let you
Okay.
know when it's there.
And I will tell everybody, because we will drop this episode again and let them know this book is out. Wonderful. Even with recipes to build for electrolytes at home that parents will feel comfortable, because there are a lot of people that they do not feel comfortable with the product based that's already out there. They feel like there might be putting, like, harmful toxins in their kids, especially whatever solutions are there to keep the shelf life.
Right.
But with this, you're building it at home and you're still providing the quality. And this is coming straight from 42 plus years of wisdom and knowledge. So this makes definitely those who are have kids, taking care of kids, the grandmas, the moms, the aunts, everyone feel, and the uncles and the dads feel very comfortable, and having a sense of feeling a little bit more empowered in taking care of their loved ones.
And
Now,
that's the whole purpose of the book, is to have caregivers feel empowered.
yes, absolutely. So now, throughout the years that you've been practicing medicine, having a practice, your own medical practice, have you ever experienced a burnout?
Maybe small degrees of it here and there.
Okay, what
Um,
did it look like?
it's like waking up in the morning and thinking, "Oh, I got to go to work again today."
Mm-hmm. Mm-hmm.
Um, but I think, given and again, given who I take care of on a daily basis, the kids quickly take care of that burnout feel. There's just vitality that exudes from kids that is
Yes.
hard to avoid. But
Mm-hmm.
so I read about burnout a lot, but I don't think I've encountered it to a really significant extent. I
Mm-hmm.
try to maximize and maintain my physical exercise
Mm-hmm.
activity, I try to involve myself in other activities outside of medicine. So
Absolutely.
trying to keep a healthy mindset as best as possible.
Has helped you. So you really find that you, because your patient population, so you wake up one morning and you're just not feeling so great emotionally, and you go into the office and boom, you just get this person that's the happiest to see you. You're a rock star in their world. They're giving you a big hug, and then the other one's giving you a big hug. I guess by the end of the day, you emotionally feel a lot better, and that's what you answered.
That's that's a pretty much the situation. Yes.
Wow. Alrighty. So we have seen, like you said, being a part of community, how that helps to pull you from not entering into burnout, because I feel like community is so good. Like you're saying, having a activities that you do that's outside of work that really broadens your perspective and draws out other aspects and love and joy within you, that helps. So those are definitely some great ways to try to avoid burnout, and if you are finding yourself going towards it, to try to reverse this. Now, I have a
Definitely.
fun question for you.
Okay.
So if you weren't a doctor, what would you be? And so you All right, so for you, of course, you wouldn't be able to do peds, you wouldn't be able to do anything with kids. And alrighty, so those are the two that we'll pull out from you. I'll give you free reign.
Okay. Um, so I love to teach. So I think teaching would be the profession that I would probably otherwise do.
If you weren't doing already, good. We have
Yeah.
a couple teachers. So we'll add you. So you're part of my utopia now, where I have all my doctor friends with different professions, interior design, some are florists, some have cafes, and then we'll have you as our teacher.
Okay. All right.
I love it. Alrighty. So now there are a lot of people out there and they're wondering, they're seeing like, wow, Dr. Kathie, I love the fact that you have such great experience. You do have your own practice and you have this wonderful book coming out. So how can I be part of your world? Like, how can I find out more about you? Are you still taking patients, or are you like, no, no longer taking patients? Or, how can we find out when this book release? Tell us, how can they find you?
Okay. So, one, I am personally not taking any new patients, but I have several providers who are fantastic who are taking new patients in my office. And you can connect with me via Facebook. And I think I've sent you my
The links.
contacts there.
Yeah,
I'm also on LinkedIn and Instagram. And then
absolutely.
my office does have a web page as well,
Mhm.
but I don't actively interact with that on a personal basis.
Okay. Alrighty. So you'll definitely be able to find the links in the show notes to be able to contact Dr. Kathie, to contact her office. Now, what about those who want to hear about this upcoming book? Are there any ways that they'll be able to find out about the upcoming book, when it's going to be released? Do you have a
Um, so I will be posting it on our Facebook page. I
Mhm.
will also be putting it on Instagram as well as LinkedIn. And then I can
Okay.
also let you know for sure too, since you have a huge following.
Absolutely, absolutely. Alrighty, so for those of you who are looking, we can go on Instagram and you'll find it as Pediatric Healthcare Unlimited on Instagram. If you're trying to contact Dr. Kathie on LinkedIn, is Kathie Wuellner, which is her name, Kathie Wuellner on LinkedIn, Facebook, Pediatric Healthcare Unlimited. If you want to find out, one, what's going on in Dr. Kathie's world. Two, if you'd like to also find out about this upcoming book, which sounds amazing, right there for the fall for that respiratory season. Alrighty, Dr. Kathie, any last words of wisdom before we exit this wonderful conversation?
I think I would just encourage everyone if they don't have a personal physician, to go out and seek one,
Yes.
because it
If
could
you,
really be a very long-term, very profitable, and very helpful relationship.
absolutely. It definitely can save lots of lives. The having that physician home, that personal physician that can help to manage what's going on in the overall care of you and also your family is very important. So if you have not sought out a personal physician for you and your family, definitely do so. Thank you so much,
Great.
Dr. Kathie. Thank you for all of this wonderful information about why a personal medical home is so important, and also for this information on this book that we're so excited that will be coming out in the fall. For those of you guys here, thank you so much for watching. Now, if you're sitting there and you're like, oh my gosh, Dr. Beckford, I didn't catch all of it, have no fear. Wonderful information and this podcast will be available on our Your Caring Docs website. That's URCARINGDOCS.com. You'll see Dr. Kathie's beautiful face. Download the episode, send it to 10 of your friends. If you are looking for a dynamic speaker on stress management or burnout prevention for your next event, send me an email at drbeckford@yourcaringdocs.com, or on my Your Caring Docs page, just hit that work with me button and we will see how we can make your next event your best event. I'm Dr. Tamara Beckford. Thank you all for reaching out, and thank you so much for joining me today on this wonderful conversation with Dr. Kathie Wuellner. We'll see you guys next time. Bye-bye.
Bye.